The biggest challenge is getting patients to goal quickly. That's been a challenge. I think our approach has been trying to do combination medicines to allow patients to get to goal much more quickly, to allow physicians to have not just one medication, but the possibility of two medications with two different targets. Again, the goal is to get patients to target, but to do it quickly and then maintain the control. But I think, again, the fact that our portfolio, we have a number of compounds, actually medicines that are available. We have a GLP-1 Bydureon, we have a DPP-4 Onglyza, and we have an SGLT2 Farxiga. And so what we do is we actually have a number of medications that we can offer patients, because not one medication can treat all patients or is right for all patients. So the fact that we have this portfolio and these combinations, we think we have a really good offering of medicines for patients with not only with elevated A1C, but other comorbidities such as elevated blood pressure, elevated or obese patients, overweight patients. So with this family of medications, we think we do have a really nice offering for patients. Well, I think what you're seeing is more physicians and what's going on in the industry is trying to, again, what we mentioned is looking at the whole patient. It's not just about blood glucose control anymore. These patients have multiple comorbidities, and it's very important not just treating blood sugars, but also to treat their other conditions. And I think you're going to see much more of that approach, a holistic approach, by physicians and by what we're trying to do within AstraZeneca. I think it's going to be important that, again, not only endocrinologists but cardiologists understand the whole patient, the metabolic disease. It's not just about heart failure or coronary artery disease, but it's about the whole patient. So patients with diabetes, patients with cardiovascular disease, the risk factors that are involved in both patients with diabetes and the fact that they can have an event, a cardiovascular event. So yeah, I think it's very important now for us to educate not only in the primary care space, but endocrinologists, cardiologists about how do you treat the whole patient. It's sort of the comorbidities that go along with diabetes. That's what we're looking at. And again, that's what I mentioned about our early development program that we're doing with our collaborations with MedImmune down in Gaithersburg, so the very early combination products that they have in development, as well as the products that we have on, our medicines that are on the market right now, and those combinations, and the fact that when you combine these various agents, so like a GLP-1, it has the benefit of lowering A1C, but it also has a benefit of lowering blood pressure. You also see weight reduction. Same with a SGLT2, our Farxiga. You have A1C reduction, but you also have blood pressure reduction, and you have weight loss. So, just think of maybe the potential, the combination of those two compounds put together for what it may mean to a patient.